Hi, everyone. This is Sarah with Connect Our Elders, and I am beyond excited to have our guest today, Tina Buchanan. She is the founder and CEO of Visionary Care Consultants, and more importantly, she's a personal friend of mine, and also she is the co-founder for our nonprofit Vets for Elders. So I'm super, super grateful to have her on the podcast today. Tina, can you start by telling us, first of all, what is Visionary Care Consultants?
Sure. Thank you for having me, Sarah. Nice to see everyone. So Visionary Care Consultants is a concierge care management group. We are currently located in San Diego, California, but we just launched officially in the Nashville area as well. So that's super exciting. So Visionary Care, what is concierge care management? Most people would probably want to know that as well. We help elders specifically, but also people with mental illness and disabilities navigate the healthcare system. So they could be struggling with a mental illness, dementia, maybe just navigating a really complex medical system for cancer or just multiple chronic issues. And we help them navigate the system. We help connect them to local resources such as home care, doctors, and we kind of oversee everything to make sure that all the pieces are working correctly. And we kind of act as that quarterback for the healthcare for the client. So if you like football, that's a good analogy.
I love that. And if you're not a football fan and you need another analogy, I will often, when I'm, interacting with families, talking to them about the value of care management, I'll refer to how a care manager can be the in-town daughter, right? Yes. Because lots of times families are geographically separated, and so the daughter just is not there. She or the son is having to jump on planes constantly, yet they have their own career, they have their own kids. And so the care manager can be an extension of the adult children to make sure that the mother or the father is being taken care of. So thank you for explaining what concierge care management is, Tina. Now I would like to share with the audience, tell us our journey. That I already know it, so I'm really excited for you to share it with everybody. Tell us your journey that led you to start Visionary Care Consultants.
Sure. So I've been in the healthcare industry as a social worker, a medical social worker, for about 14 years now. Every time I tell this story, I have to rethink how long it's been. 14 years now. I started out in skilled nursing facilities here in San Diego County as social services director for multiple facilities. And then I transitioned and I did social work in the home as a home health care social worker, which is paid for by Medicare. And I loved that because I got to see people in their own environment. And it's completely different from the skilled nursing setting. In the skilled nursing setting, they're going to just tell you whatever they want. The goal is to get them out, to get them rehabilitated. But in the home, you really get to see what's going on. And they're a lot more vulnerable. And I loved just interacting with them and having them open up to me and let me be a part of their world, per se, right, as it is, and then guide them through the next steps. So it was probably about 8 years into home health. I started having clients call me after they would be discharged saying, Tina, can you help me with this? Tina, can you help me with this? And I couldn't help them. I'd have to refer them out. But I couldn't help them because I was no longer providing services to them. So I thought, you know what? I have enough connections. I've been doing this. I have a great reputation, so I'm just going to go out on my own and start a concierge care management group. And so that's what I did in 2017.
And it's been awesome, has it not? I mean, you've experienced phenomenal growth and people in the community absolutely love you. And we've got Nashville on the horizon. So we're going to have to start pounding away at that market. But for those of you listening, I will tell you, so I've worked with a lot of care managers since entering the industry in 2012. And Tina is certainly special. Her level of compassion and patience, like there are situations I don't even know how she's able to handle it because it takes a certain level of patience to handle certain circumstances. So let's talk about how Visionary Care Consultants is truly different from other care management firms, whether it be an independent care management firm or, the home care organizations that have in-house care managers. But there's something very distinct about how Visionary Care approaches offering care management to clients.
Yeah, so we really take an individualized approach. And I know everybody says that, but what sets us apart is we are a team of clinicians, social workers, master's level social workers, and LVNs, RNs. Sorry, I can't talk today. RNs. We also are looking at hiring a psych social worker so that we can address all of the areas and do it as a team. So we believe we are more effective when we have a team, because as a social worker, I'm not a nurse, so I don't need to pretend to know what they know, and vice versa. So we work together, and it really, really helps the patient. That's one thing that really sets us apart is when you sign up with Visionary Care, you get the whole team. Sometimes it's 2 social workers, sometimes it's 2 nurses. You get what you need, not just one person. You have multiple people you can call for multiple things.
And I love that. So it reminds me a lot of the interdisciplinary team approach that many hospice companies will use, right? They'll have the social worker, the nurse, the medical director, whatnot. And it's, and it's not, and I want to clarify for the audience, it's not that you wouldn't have one point of contact with Visionary Care. It's that you have access to whichever professional has the area of expertise with whichever need that you have any given moment, and so they kind of interchange out. So it's a very fluid, appropriate resource for people who have not only clinical issues, but, needing access to resources and help in applying for those benefits and whatnot. So it's 2 different skill sets, and you get both of those with Visionary Care. So we have talked a bit about psych. So, you guys have psych patients, but is that your niche?
I would say it's probably one of our bigger niches. I mean, most of our clients are elderly, but we see that a lot of them do have co-occurring psych issues. We do see about probably 30% of our clients have some sort of psych component or co-occurring drug and alcohol and psych issues. So I would say that it's one of our niches. And we are hiring for that right now because there's such a need. There's care management in San Diego is a huge business. There's more people that need it than are available. But what's even more needed that I have found out in the 3.5 years of doing this is that it's even more needed for the younger demographic with a mental illness. They need resources just as much. And because I have a very diverse team, we can specialize in that, and we're good at it. And we are building a foundation so that they will be successful in their aging years. So it all comes to fruition.
That's a really good point, because if you could start helping these people experiencing whatever mental illness they may have and get them on a good care plan, you can hedge off a lot of potential issues in the future, making sure that they are taking care of their current medical needs. And then the other thing is I often find that people don't really understand the value of care management. They always think, oh my God, this is such an expensive resource, not understanding that by implementing care management, you could end up saving yourself a lot of money overall, because it's a proactive service that can prevent crises from happening. And they can prevent from the adult child having to fly, from one city to the next, however many times in a year,
Yeah.
So I always...
Sorry, Sarah.
Oh, okay.
A lot of our clients experience that, right? So they have this idea that, why do I need to pay someone to do this, right? That's the biggest question that we think they're saying. And when they get involved with the care management group, Visionary Care specifically, they are coming back saying, wow, you saved me so much time. You saved me so much money. I'm happier in my marriage. My kids are happier because they're the sandwich generation. So they're taking care of mom and dad. They have kids at home, especially with COVID. We've seen a huge uprise in the adult children calling us for that reason. They can't manage doing their school at home with their kids. I'm familiar with that. They can't manage hearing information from a doctor from so far away, and they're not flying out here like they used to manage all of those things. So we're definitely seeing that with COVID, it's actually more valuable than it was before to these households, because they are worried about their loved one and they can't get there to be their advocate.
Exactly. Do you would you like to take a little bit of time and talk about some of the unique programs that you have within Visionary Care? So aside from the fact that you guys do the hands-on care management, you have, I think it's called BFit program. And then We Care. So, you can go ahead and share about that if you want, or I can just provide a link.
Yeah, I can share a little bit. So traditional care management is anything from, like I said, navigating the healthcare system. It's usually billed at an hourly rate. And I, being a social worker, have always believed that things need to be customized for everyone that's out there. So a couple of the programs that we have besides our traditional care management program is we have BFit, which is a brain fit program for elders or anybody of any age who is struggling with their cognition, and they need routine and they need activities and they need a certain diet in order to keep their brain fit. There is research that shows that these programs work. And so we have that program. And then we also, when COVID hit, we knew we needed to do something different again, right? Times are changing. What can we do to meet the needs of our clients, of our families? So we developed We Care. And We Care is a virtual health management program similar to care management, but it's not in person. So they get access to a care manager virtually to do telehealth visits, phone calls. We use a HIPAA compliant texting and communication platform. We can video with them and we can see what's going on without having to put them at risk of COVID-19. So those are two of the programs that we have besides care management. We're looking into others. I have another one on my brain, but that's what we have right now.
We always have lots and lots of ideas, don't we? Well, you've certainly been executing well with Visionary Care, and I think it's great that you have, of course, the in-person care management, but for those families that, are a little bit more apprehensive about somebody coming in the home, they can still have the benefit of care management through We Care. So I think that's phenomenal that you guys have done that. Tell us what you love most about working with elders.
There's so many things, so many. But what comes to mind is just talking to them and building a relationship with them and becoming their extended family. I love it because they are so knowledgeable. They want to be heard. They want their wishes to be known. And sometimes they're not. In the system, it's like 5 minutes in and out, doctor's appointment, right? They just want people to connect with them. And I love listening to their stories. We have a lot of veterans here in San Diego. The things that these people have done in their lives and what they have survived is, I'm getting chills just thinking about it. That's my favorite part for me as a social worker is, being that person they call when there's an emergency or they're just lonely, saying, what do I do? Like, that is value. And it also feels amazing that someone would reach out to me and see me as that person to call when they need something, because we built that relationship.
Yes, definitely. I always think that I'm going to get used to it, meaning used to the fact that by the time that people get to you or they call me, right, that they are so overwhelmed and they don't know what they don't know. They don't even know which direction to look a lot of times. And I always think I'm going to not be surprised by that anymore. But each and every single time I have that conversation, I'm like, I can't believe nobody has told you about these resources before, and it just boggles my mind. And so it is, as Tina's saying, it is incredibly satisfying to be able to be the one that has the conversation with them and let them know there's hope, basically, that you can alleviate some of the overwhelm and the stress and the pain that they're feeling. All right. So we talked a little bit about how there is the expansion happening in Nashville, Tennessee, and it was official today. So do you want to go ahead and share with the audience who you found for a care manager out here?
Sure. I just brought on a nurse care manager. Her name is Teresa. She will be working the Nashville area, and she comes to the table with 30 years of experience working in the healthcare industry. She has a great, solid case management background, and I think she's going to be a real asset to the team. You know, I have always been a big believer that you can teach people case management skills, but you can't teach them values. And so every hire and every person that I bring on, I'm big about this right now, is I hire them not only for their expertise, right, but for the same values that I hold. So my whole team that I have right now is phenomenal because they have the same core values that Visionary Care is founded on, and my core values. So I'm very proud of that, because that's what seemed to work for us the best.
Yeah, your team is amazing. Absolutely amazing. So tell everybody listening how can they identify? Because I think lots of times people, they hear you and they hear what care management is, but they don't know how to recognize when they should call you. So, everybody knows elders, whether it's your own parents, your grandparents, your neighbor, your colleague at work has parents, right? So we all have interaction with elders, but how can they identify, boom, I need to call Tina. I think that there's a care management need right here.
That's a great question. Anytime you have an elder or even a younger individual with mental illness that you're seeing that there are multiple chronic medical or psychiatric conditions, or someone that's on a lot of medications and maybe they're falling in the home or they're confused, that's a great time to look at the situation and go, how can we change this? What can I put in place? Because there is a better way. They don't know it yet, but there is a better way. Another great time for someone to reach out to a care manager is if they are feeling financially drained and the financial and emotional impact of their elder loved one, right? So we're talking about, like we said, hopping on a plane, they're trying to deal with their kids. Those things can be done by a care manager and take that burden off that family member. And also the financial burden. I mean, one of our strengths as well by having social workers and LVNs and RNs is that we're often able to identify financial resources for these families to help offset the cost of care management. And so when they realize that, they're like, it's a squash, because even though we paid you to do this, you got us VA benefits. We now have home health care paid for by Medicare. Some people don't even know what's available to them. We had a situation, I think this was one of yours, Sarah, where the hospital discharged and recommended 24-hour or 12-hour care. With the care manager assessing that may not be the appropriate recommendation.
Yeah, I find that a lot, is that it's just, I mean, the doctor, I'm not saying the doctors don't care. No. Obviously, they care about their patients, but they don't, they just want to make sure the person's safe. And so, of course, they're going to say 24/7 care, or you need, 12 hours through the night. But that is really expensive. You're talking in San Diego right now. I think the average cost of caregiving per hour is $32 an hour. So if you've got 12 hours a day, that adds up really quick. But, if you, like Tina's saying, if you have a professional care manager come in and assess the situation, it very well could be that the person's sleeping all through the night and there is a well spouse there. So is it needed at nighttime? Maybe not, but it really does take a credentialed professional that knows the right questions to ask. And also, not only that, because I'm sure you've seen this, Tina, sometimes they'll tell you just what you want to hear. And so it takes a keen professional with lots of experience to kind of read between the lines and actually figure out what the real situation is, so that you can develop the true appropriate care plan. And so guys listening to this, I mean, that is why you need a care manager. I cannot harp on the value of care management enough. I really can't. Okay, Tina, so how can people get in touch with you if they feel as though they have identified somebody needs a care manager? How can they get in touch with you?
Sure. So they can reach out directly to us by phone. Our telephone number is 619-228-3584. If there's a way to put it in the link, we can do that as well. The other thing is they can reach out to us online at www.visionarycaresd.com or send us an email at intake@visionarycaresd.com.
Okay, thank you. Now, they can have a conversation with you, right? Without having to financially commit from the very beginning. I mean, they can still get some guidance from the get-go. Okay. And is that?
We offer a free 30-minute consultation that's done by phone, where we go over kind of what's going on and how we think we can help. And from there, we come up with a plan. I will say that the other thing that sets us apart is we do have hourly rates, but we also have packages. We also do a sliding scale fee for those who are lower income. So we like to gather the information, do the assessment, and then see what we can do from there. So we try to make it work for everybody's budget, everybody's needs. And people tend to love that it's not a one size fits all. There's options.
Right. So I can personally testify to the fact that Tina and all of her team members and Visionary Care is a care management firm. Their hearts are absolutely in the right place, and they will do anything they can to help our elders, and so I highly encourage you that if you are feeling overwhelmed dealing with your own parents, or if your grandparents are needing more care, I really encourage you to reach out to Visionary Care Consultants, because just with one conversation, you will feel a sense of relief. I have no doubts. So again, Tina, what is the telephone number where people can reach you?
Sure. It's 619-228-3584.
Wonderful. Okay. Well, thank you so much for being the guest today. As a reminder, I am Sarah, and I'm the founder of Connect Our Elders. Connect Our Elders is all about resource, education, navigation, and ongoing advocacy for our elders and connecting them to those resources. So if you have any questions whatsoever, just send me a message, or you can reach me at 858-222-9241. Again, thank you so much, Tina, and everyone have a great evening.
Thank you for having me. Bye, everyone.